Well, hello, and welcome to this JBI Live webinar, which is hosted by Wolters Kluwer Health. My name's Alexa McArthur, and I will be your host today. I'm a research fellow at JBI in the implementation science team, and I look forward to today's webinar with a focus on putting evidence to work, practical tools for clinical change. Now, I'm very excited today to be joined by two wonderful panelists, Professor Robin Christian and Professor Michelle Palokas of the Mississippi Center for Evidence-Based Practice at JBI Center of Excellence, and I'll formally introduce them in a moment. Just before we get into the session today, I just want to acknowledge that I'm delivering this webinar from the lands of the Kaurna people of the beautiful Adelaide Plains in South Australia. And I want to acknowledge the traditional custodians of the various lands on which any of you work from, and any Aboriginal and Torres Strait Islander people participating in this webinar today. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connection to the lands and waters of Australia. So if you are an avid user of social media, we would encourage you to post or share your reflections and your thoughts around this webinar, and some of the hashtags are here on the screen that you're able to use. So let me formally introduce our panelists to you. So firstly, Professor Robin Christian, who is the School of Nursing Director at the Mississippi Center of Evidence-Based Practice, University of Mississippi Medical Center. And Robin is a recognised leader in evidence-based practice. As the director of the Mississippi Center for Evidence-Based Practice, she helps advance the integration of evidence into clinical workflows to enhance patient care across various health systems. And also we have Professor Michelle Palokas, who is the Professor of Nursing, the Associate Dean for Administration, and the Deputy Director of the Mississippi Center of Evidence-Based Practice at the University of Mississippi Medical Center. So Michelle is a dedicated academic and clinician specialising in evidence-based nursing practices, and she plays a pivotal role in advancing nursing education and evidence implementation at the University of Mississippi Medical Center. So I'm really looking forward to hearing from both Robin and Michelle as this session unfolds. So just before we get into the session proper, I just want to do a little bit of an introduction and set the scene before I hand over to our panelists. So on the screen here, you can see JBI's approach to evidence implementation. And I just want to quickly highlight this. Some of you may be very familiar with JBI tools and resources, and some of you may be the first time you've seen this. So on the right-hand side, the very colourful model is JBI's conceptual model of evidence-based healthcare. And this is considered a benchmark in the global healthcare industry. So JBI has developed a collection of world-class resources which are available on exclusively on OIBIT. And today we really want to highlight the evidence implementation component of this model. So we know in practice that clinicians face many challenges when it comes to implementing evidence-based practice in their clinical setting. And this is often due to limited resources and access to implementation tools. So this gap really highlights the need for implementation frameworks to assist with evidence implementation. So JBI's model on the right, you can see the evidence, the orange wedge of which focuses on the evidence implementation part. And evidence implementation in this context is really referring to or defined as a purposeful set, an enabling set of activities designed to generate sustained improvement in the quality of healthcare quality. So the components of evidence implementation in the model there relate to context analysis, facilitation of change, and then evaluation of the process and the outcomes. So based on this JBI model, we have further worked this into the JBI approach to evidence implementation, and this is the figure on the left. So this model really is a process model that provides a phased approach for all things that you need to consider when you're thinking about implementation work. So if you want to find out any more about the JBI model, please take a look at our website at jbi.global. So today we are going to focus in on a tool that is available through the JBI suite of resources, and we want to focus on this tool, JBI PACES. So to help within the evidence implementation space, JBI PACES has been developed as an online tool which helps to support and streamline evidence implementation and quality improvement projects. So just to briefly summarise some of the features of JBI PACES, it's an application that facilitates an approach and a flexible quality improvement approach for evidence implementation work. And you're also able to do other types of primary research projects as well. So some of its key features are that it includes a link to evidence-based criteria, which is all linked to evidence summaries, and I'll touch on them in a minute. You're able to do very small-scale projects, or you can do large-scale organisational projects across multiple sites of quality improvement cycles. It really helps to facilitate the practice on the process of evidence-based practice change. So really, PACES really helps to strengthen your ability to support any evidence implementation work, and we just want to highlight that through the webinar today. So just very briefly, some of the key features of JBI PACES, which I'll just highlight. You're able to create your projects, whether they're for evidence implementation or other types of research projects, and you can access JBI's database of audit criteria and select from these pre-existing audit criteria for your project. You can generate different types of reports as well, and you can see them on the right. And you're able to add your own custom or create your own custom audit criteria or different types of criteria as well. So generally people will use a compliance or Boolean criteria where you answer a yes or a no to a certain question, but you're also able to have categorical data such as using single or multiple checkboxes or continuous or discrete data. And you're able to also collect demographic data as well, which can be exported also to an Excel spreadsheet, which is a really handy feature of PACES. One of the benefits of JBI PACES is that all of the specific criteria that are related to a particular audit topic are derived from evidence summaries, which can be accessed via the JBI EBP database via Ovid, which is a database of appraised evidence. So research fellows within JBI develop these evidence summaries, and these are short abstracts that summarise existing international evidence on common healthcare interventions and activities. And they're all based on structured searches of the literature from selected evidence-based healthcare databases. So the audit criteria then are explicit statements of what should be happening in clinical practice, and these are all derived from the best practice recommendations that are within the evidence summaries. So this is a real strength of JBI PACES, that people are always thinking about the evidence that informs their audit criteria. So there's a number of different project types that you can use for various whatever your various needs are, and you can tailor this to different types of research projects such as evidence implementation and ongoing work in that space. And there are also many different analysis and reports that can be generated from within the system, and these can be exported into Excel or as PDF or Word documents, which gives you that ability to be flexible. And you also have the option to conduct evidence implementation projects. So by using this software, JBI PACES, you're able to design and conduct baseline and follow-up audits in a structured and user-friendly environment. And they may be small single-site audits, or they may be large multi-site projects across a whole organisation with data input from multiple sites with multiple participants or users. And one of the most important features within JBI PACES is the Getting Research into Practice, or the GRIP analysis module. So this encourages people who are conducting these projects with their project teams and key stakeholders to reflect on the results from their baseline audit. And GRIP is a process then that supports this practice change because it helps to facilitate a step-by-step approach to identify your key stakeholders, identify key or your barriers and your enablers, and you're able to select which ones are actionable, develop strategies, and plan to change behaviour in your setting. So based on the information that you put into the software, it might look something like this on the screen, adding your individual barriers, your enablers. You can specify what type of barrier or enabler it is, and then you're able to map that. So you're able to map this to various other implementation theories or frameworks, such as CIFA or theoretical domain frameworks. So it gives you various options to look at the different frameworks that you might want to be thinking about as well in terms of this. So JBI PACES is a resource available for you to access with the aim of supporting evidence implementation work. So I am going to hand over now to Robin and Michelle, and they're going to share about how they use JBI PACES within their setting, and I look forward to handing over and hearing from them. Thank you.
Thank you very much, Alexa, for that introduction and for telling the audience more about PACES. I get to tell you a little about who we are, how we use the JBI evidence implementation methodology, which then allows us to use the PACES software. So first, as Alexa stated, Robin and I are both nursing faculty at the University of Mississippi Medical Center School of Nursing. Our campus is a large one. It's a great academic healthcare community. We're the state's only academic health science center. We actually have 6 health science schools on campus. So in addition to nursing, there's a medical school, school of dentistry, health-related professions, graduate studies, and population health. And on our campus and our online students as well, we have enrollment of about 3,000 students across all schools, but we're the largest school. We have about 900 students currently enrolled within our School of Nursing. Our School of Nursing was founded in 1948, and the mission of our school is to develop nurse leaders through our innovative partnerships, unique community-based systems, evidence-based practice, and research. Within our School of Nursing and those 900 students, we have multiple programs and tracks. We have undergraduate, graduate, and doctoral programs, and you can see those listed on the slide here. In the previous year, we had 454 graduates within our school, and 23 of those, you'll see the red circle, were DNP, or Doctor of Nursing Practice students, which is going to be our focus of our conversation today. Robin and I are both faculty for the DNP students. We currently have about 45 or 50 students enrolled during the summer semester, with about 20 more coming in the fall. So we're busy, and that's how we began to think about JBI methodology for our DNP projects, just getting busier and needing some structure to our DNP projects. Robin and I are also the director and deputy director of our Mississippi Center for Evidence-Based Practice, which is housed within our School of Nursing. And through that center, we support the mission of JBI and Cochrane. But specifically to our DNP students, I'm going to focus on those students for a while now. In 2015, we integrated the systematic review methodology, JBI methodology, into our DNP curriculum. In 2018, we were designated as a JBI Center of Excellence, and in 2019, we became a U.S. Cochrane affiliate. And in 2021, we transitioned from that JBI systematic review methodology to the JBI evidence implementation methodology for our DNP students and into their curriculum, just because we felt like it was a better fit for those students. And here's why. If you do not know what a DNP student is, it's a Doctor of Nursing Practice, so it's a terminal degree in nursing practice. And the objective of becoming a DNP, we want to prepare those students at the highest level of nursing practice to improve patient outcomes and translate research into practice. So the JBI evidence implementation methodologies just seem to fit perfectly with that objective of preparing those students. And Alexa has already shown you the JBI 7-phase methodology, which is here on the left side of your slide. But on the right side of this slide, you will see a timeline of how we integrate each phase of this methodology into our DNP curriculum and coursework. So DNP 702-1 and that little orange arrow pointing down at the top, that's a course. So each of those are course names on those colored arrows. And you can see that we integrate each phase of this methodology into a project, a DNP project course throughout the DNP curriculum. And therefore, we get to utilize the PACES software along with this implementation of the methodology. And Robin is going to talk to you a bit more about that.
Yes, thank you so much. So this screen you might have seen before with Alexa. This is how we access, this is our login to PACES. And PACES stands for the Practical Application of Clinical Evidence Synthesis. And it is a software program that really helps to house and collect data for our implementation projects. And Alexa gave us a great overview of how PACES works, and it has multiple applications for clinical projects. We at our university have a subscription to PACES and also the JBI database of evidence-based practice database, which gives us access to all of the JBI tools. But participants that take the evidence implementation course receive access to PACES for a year, which is a very it's a great benefit to have, because once you learn to use a program, you can continue using that program after you have been trained if you want to continue on with other projects. So you do have access for a year after your implementation training. So as Michelle indicated, we store and use this throughout the DNP curriculum, and we keep all of the information in our e-learning management system. And at our university, we use Canvas, and we just progress semester by semester into this learning management. And we build in assignments based on the project and things that need to be completed in PACES as a part of their curriculum for that semester. And it makes it a very easy place where all their information is housed in one location, so they can go to one home page. Then that will take them to other areas if they're looking for information that they can find there in that course. And this is just showing you an example of once you get into PACES, it's just a screenshot of where you can see kind of at the bottom of the screen, that is our table that it's created. The audits are done, so we store our data, our pre-audit data in PACES. Then we do our implementation, and then our post-audit data goes into PACES, and it makes this beautiful chart for us where we can see our pre and post implementation. And that is able to be exported out, and that then can be included in your manuscripts. Also, in PACES, we can build our grit table, which is getting research into practice. And this really helps us identify our barriers to implementation and how we're going to work around those barriers. And also our facilitators, what's going to help us get this change and implementation into practice and be sustainable. And all of that is in the PACES that can be exported. So it's a great tool to store all of our information and then to be able to export that out. And JBI has an amazing area on YouTube. If you need any help, they have a great YouTube channel to access resources on how to use PACES, and there are other software programs too. But if you get stuck in an area and you're not sure how to enter the data or how to export it, you can always go to their YouTube page and find those very helpful videos that will walk you through and show you how to get over those stumbling blocks. And this is a picture of Dr. Linda Upchurch. She is the director of our DNP program, and she loves PACES. She's really the PACES queen and should be on here with us tonight. She loves to make videos, and so she will go in, and she has made several videos for our students, actually going through, walking through the entire process of entering data, exporting the data. And this is just an example of one of her videos that we keep housed in our e-learning management system that is also a resource for our students. And this is our contact information. We would love to hear from you. We actually had a school reach out to us just a couple of days ago, interested in how we are using this with our DNP students. As Michelle mentioned, the evidence implementation program has just given us so much structure with our students, and it's allowed us to be, as a growing population of students, for us to be able to manage as a faculty member the multiple projects that we're trying to manage. And this just gives us a great tool. I think it's a perfect fit for the DNP students because we are implementing change, and this just gives us the structure and the software to be able to make that project much more streamlined. And our students really appreciate that structure and just the process that is very easy and we get templates that tell us, what needs to be in each section and how to do each part of the process of those 7 phases of the evidence implementation. So if you are interested, we would love to tell you more about how we have worked this in with our students. So please feel free to reach out to us. And I think that is the end of my section. If Alexa, I know we have more slides. I don't know if we're stopping here for questions.
Yeah, no, we are. Thanks very much, Robin. So, look, please feel free, and thank you for those, for that presentation and update about the work and the way that you've integrated the use of the JBI tools and resources, and especially PACES within your DNP project. And I just think it's a really innovative approach. And obviously is working really, really well across your university, which is fantastic, and fantastic for your students to have such a wonderful learning opportunity. So please feel free. I just want to open this up. If there's any questions at all from anyone attending the webinar, we would love to have any questions about PACES at all, or about how this has been integrated within Robin and Michelle's DNP program. So I just have a few questions that I'll just highlight for you, Robin and Michelle. So when you are using JBI PACES, do you present it to your students? And it sounds to me like it's much more than just a data collection tool. Do you find that it really enables that learning about the whole process of evidence implementation, and how do students find that that it helps them in their learning around the evidence implementation methodology, I guess?
I can answer that, Alexa. Yes. Thank you for the question.
Great.
So one thing that we have done is we've built assignments. So as the students go through the 7-phase project process, and the PACES software supports them in each of those phases, we build in assignments where they can export something from PACES. So maybe it's their pre-implementation data. They can export that from PACES, and we have them submit that as an assignment. So I think that the students really see the value in that because it helps them with their assignments. And so not only is it supporting their project work and keeping them on track, but it's helpful for them because it makes their assignments a little easier, I believe.
Yeah, yeah. No, that's it sounds a very kind of interesting as far as being able to meet those deadlines and to give them really those key opportunities in that way. And do you think too that the use of PACES, you know, are there other factors or other information that really helps? What else helps to enhance the process for students learning about evidence implementation? Is it the actual conduct of the project itself? Because how long do they have to kind of complete this evidence implementation or quality improvement work?
So it's about a year. They start in the spring semester and they complete their project the next spring. They do a project presentation at our annual School of Nursing Research and Scholarship Day. So the whole process, they have about a year to complete, which of course, you know, differs between every student depending on the type of project, but they have that year to fully complete their project.
Yeah, okay. And obviously, I guess within PACES, then they're really able to break that down and as far as have very clear timelines. Obviously, that is tied in then with the assignments that they have due as well. And so that's really helpful in that way. So what do you see is some of maybe the main barriers or challenges for your students when using JBI PACES? Or are there any barriers or challenges? I'm sure there are, but
I'll answer that. I think the barriers are actually more with the quality improvement project and not with PACES. PACES is very straightforward, but it's funny because the students, they think one thing is going to happen and they've already kind of thought through their implementation before they have looked at their baseline data. So they're thinking about it kind of backwards, and it's that barrier that of trying to get them to realize we have to look at our baseline data first before we make that implementation decision. And so it's kind of changing their thinking because they come in ready to go. They already know what they're going to implement and what they're going to get done. It's like, nope, we got to back up. And because we've got to go back and look at the data and first. And one thing that I like about PACES is the grip table, because we look ahead and identify those barriers and facilitators before we even get started and start thinking of that ahead of time. Because we have to, change is hard. And even students that are working in that setting think that they're going to be able to just come in and make things happen. And it's not always that way. So I think that's the biggest barrier is kind of changing their mindset of what really is going to happen during the project. Is probably not what they think is going to happen.
Yeah, no, absolutely. And I think, you know, I think that's a really, you know, useful point highlighting that I think the JBI evidence implementation approach and giving you a very clear process in the 7 phases that was shown in the presentation earlier really help people to break down each section and to be able to make that more achievable, because I think for many clinicians, implementation work, it is very challenging in complex, you know, healthcare environments, and to be able to break it down into sections really helps people then to actually progress their work, and so I think that is, you know, one of the benefits. I guess working around some of these challenges also that you mentioned, and that's good to hear that PACES, it's not in itself that it's a really challenging piece of software, but I really like the way that you've got or that you've created, you know, the little YouTube clip from one of your faculty staff to be able to help students in the use of PACES, and also highlighted that JBI do have a PACES knowledge base. So there are short snippets of videos for each stage of wherever you're up to in your project. If you're creating your project, if you're trying to enter data, and you get stuck on one piece, and so that's a really useful resource, and that's all on the PACES or from the JBI Global website as well. So all of those tools are you know, completely you know, available there. So that's good as well. So, okay. Now, I just wanted to sort of ask as well, you know, as students also, I know that part of, you know, obviously PACES and accessing the audit criteria, they are all linked, as we highlighted earlier, to the evidence summaries. Can you explain in a little bit more detail how that has helped your students learning around the use of evidence and for them to really understand the use of evidence in their practice? Would one of you be able to address that?
Sure, I can, or I can attempt to, Alexa.
Yeah.
So our students actually this semester wrote their own, or in the spring semester wrote their own evidence summary. So that was very valuable for students to learn that process that JBI is using to write evidence summaries. But having a succinct evidence summary about any topic, almost any topic you can imagine, available at your fingertips is just amazing. And I know that our healthcare partners are also using evidence summaries. But to have it linked in PACES where you can access the evidence that you need to support an evidence implementation or quality improvement project, you have those best practices in an easy to read format. That is one of my most favorite things about PACES, that just everything you could need to implement change and improve practices in your healthcare setting is right at your fingertips through that software.
Yeah, no, that's great. And you know, and that makes it, I guess, that learning opportunity to really understand the evidence is fantastic. So, and I know that your group have really have been able to do that and really take a deep dive into that. So I think that's a fantastic learning experience for your students, which is great. So
I did want to add.
Oh yes.
Yeah, I just wanted to add a note that I just wanted to really give a plug to JBI because there's so much work that's done behind the scenes in creating those evidence summaries, so that those are available to you. So if you're interested in doing a project, JBI has already developed hundreds. I don't know the exact number, but Alexa might can help us with that. But those evidence summaries are available to you to answer your clinical questions and available, you know, at point of care where you can get best practice recommendations for your clinical questions. So there's a lot of work that has gone into those evidence summaries to give us that quick evidence-based information, and it's just a great tool. And then to have that linked into PACES to where you can access that, and you can even add audit criteria to your project and link that to other evidence summaries. So it has a lot of flexibility and maybe not just focused on one question. You can pull in other best practice recommendations in PACES also.
Yeah, no, thanks for highlighting that, Robin. And I know that for a lot of people that that we've worked with on their evidence implementation projects, the learnings that they take from that, it's a lot beyond just actually doing their actual, you know, implementation project, and they really take those learnings on into their future work, which is obviously what this is all about. So I just have a question here from Gizu from Ethiopia. Thanks for your question. So, and they say, may I ask how PACES is different from, say, a PDSA cycle? So thank you for that question. I don't know, Robin or Michelle, if you want to have a go at answering that. Or I guess how you would feel that it would add more than just doing a PDSA cycle.
Yes, so I can attempt to answer, and maybe Michelle can chime in. So it is different from PDSA in the fact that it's more of the beginning is audit criteria where we're measuring before and after data. But when we do get into our implementation phase, we do incorporate a lot of that plan, study, do, and act. So I think it's an added piece to PDSA. So we're collecting audit baseline data at the beginning to see where we need to implement change. And then we can use that PDSA cycle to help us with that implementation. And then after implementation, then we remeasure those best practice, our audit criteria. So I think it's a complement that we do both the audit and we do that PDSA with the implementation. If that makes sense, I hope.
Yeah, no, thanks, Robin. So I was also just then wondering if you actually have any of your students, if they're working in, in a healthcare organisation that uses a different, different data collection systems. Is that ever an issue for you to work around when also using PACES? And does that ever cause any issues for people or for your students if they're undertaking? I guess you're advocating the use of PACES for them, but if they're working in a hospital where they're having to use other data collection systems, is that ever an issue that you've come across?
We have not had that issue come up yet. And actually, we are in conversations about training our hospital partners on the use of PACES. So we have organizational access to PACES now through our Roland Medical Library within our university. So everyone in our organization has access to our PACES software, or JBI's PACES software. PACES software now. So we're going to make sure everybody knows about that and knows how valuable it is.
Yeah. No, that's great. That's great to hear, and that's great that you're able to really promote the use of PACES in that way. And I know in our setting here in Australia that we've often had the situation that people are working in healthcare organisations where they are having to use different systems for quality improvement projects or evidence implementation work, and it doesn't seem to be. It's not an issue. They can still use the process of PACES, be able to really use the audit criteria and how it's linked to the evidence within their projects, even if then they're collecting. And I guess that's one of the tools that we really highlight within PACES is also that functionality that you can export to Excel. So you're able to export your data to Excel, and then if you're wanting to, you can, upload that into another system. So it also has that, I guess, benefit of being able to be used in different data collection systems as well. So that's also a really a neat function of JBI PACES as well. Can I also ask you, or either of you, can you provide an example of an actual implementation project that one of your students has been involved in, and just highlight, I guess, just for our audience, how they've gone about using that, or what has been some of the specific, I guess, outcomes from the project?
I have a favorite project. I know Michelle has one too, but so I will share mine. My student is a school nurse in a school setting, and she's interested in implementing Narcan for drug overdoses to be available on campus for faculty or non-medical bystanders to be able to have Narcan if one of their students overdosed. And so she worked with several schools, I think a couple within the school district. So she was able to implement education and was actually able to receive funding to purchase the Narcan to be placed into the school setting. So I think that was one of my favorite projects, because just the impact that it had to be able to have that access and to be more than one school. It was system-wide that she was able to implement that. So that was an exciting project for me.
Great, thanks, Robin. Do you have one, Michelle, that you want to share?
I have so many that I'm afraid to start sharing, but I'll share just one. So one of my most recent graduating students worked on a project. She works in neurology. She's a nurse practitioner in neurology, and she works with stroke patients. And she implemented post-discharge telephone calls for stroke patients and made a tremendous impact on their readmission rates. So that's been one of my favorites to date.
Right, well, that's good. And have you been aware then of students continuing, like once they finish your DNP program, that they've continued with their evidence implementation work in an ongoing way, or have continued to do to continue that project? Are you aware of any of those sorts of experiences?
So it's funny you asked that right after I talked about this student, because the same student just asked me to help her with an additional project, and she has graduated. She is done with school, but she's asked me to help her with some follow-up work related to stroke readmission. So that's the only one I've heard of. I'm sure there may be others, or Robin may know of some.
I do remember before we taught this course to our DNP students, we taught it first to population health master's level students. And one of those students did a project. I can't remember exactly what his project was, but it was in an outpatient setting of a large hospital system. And he made such a difference in that one clinic that they wanted him to make those changes in their other outpatient clinics. So it's funny, just one small little change can really make a big impact. So that was another one that I can remember that continued on after their first project.
Mm. No, that's really wonderful to hear, and I think that for people to be able to feel that they can use a tool such as JBI PACES to help to really drive their evidence implementation work and then moving on into their future careers. I know we often have clinicians will join our training program, and then they talk about how, really understanding about how to use evidence, how to understand evidence in their context, how to use it in their clinical settings is like a light bulb moment for them. And then they really develop, it ignites a passion in them for moving on and doing, creating future implementation and I guess mentoring others to do that sort of work. So, which is obviously exactly what we want, from a program of doing evidence implementation work. So, so that's great to hear about. One of the other questions is just about whether we can receive a copy of the slides, because they really enjoyed or loved the diagrams which were shown, which is great. And so obviously the presentation will be available in the next 24 to 48 hours. And we can certainly provide a PDF copy of the slides as well. So that hopefully WK would be able to send out as well. So we can let you know about that. Robin and Michelle, have you got any other points that you would like to highlight? Otherwise, I'm just going to go on to the next few slides, which might encourage some other things to come out anyway. But is there anything else you wanted to add at this point?
I can't think of anything.
No, I just encourage anyone on here that wants to learn more about how we use PACES or the evidence implementation methodology with our students. We would love to chat with you. We could talk about it all day.
Yes, this is our favorite topic.
And likewise, I feel the same way. So, look, so just these are just a few more slides, just to kind of before we wrap up this session. But I guess we just really want to highlight that. I mean, certainly you can, you can have access to JBI PACES, to the software tool, and I know people who have just used it, but a lot of people do actually find doing a evidence implementation training program through JBI or through one of our collaborating entities is a really fantastic way to learn the processes. I think for many people starting out, it can seem quite overwhelming and quite daunting, but it's breaking it down and learning more about not just the JBI evidence implementation model, but also the other various theories, models and frameworks. And this is all part of the JBI evidence implementation training program as well. So if you do want any further information, there is the link there on the screen, and we would certainly be more than happy to answer any questions, about that training program. And I think Michelle had mentioned how within the Mississippi context, what you've done is it takes, this program of work takes about a year. Certainly we see that people, they might do it within 6 months, but it generally tends to be 6 to 12 months to really be able to, overcome the different challenges and to really introduce change in their setting. It takes time and a commitment, but is a really valuable process indeed. Also freely accessible from the JBI website at jbi.global is our manual for evidence implementation. And a lot of the things that we've discussed today are highlighted further in the manual. So there's a lot of key learnings from the training program that are available there as well. So have a look at that as well. And I also just want to highlight that we do have a journal promoting the work of evidence implementation, and it's called JBI Evidence Implementation. So if you are interested in publishing any implementation work or methodology even that you've been involved in, please do consider submitting to this journal. And it's a very interesting read, and what we're always encouraging people who are involved in this type of work is to publish, to write up and publish their work, because you might find that given the context that you're working in, it might be quite different to somebody else's setting and context, but there are always key learnings that people can take from, especially from similar projects that have been done. So please have a look at that. There are methodology papers as well that might be of interest to you as well. So have a look at that if you're interested in this type of work. And I also just want to highlight, if you are interested in reading further around some of the work that's currently being done, here's an example that it's done in a large tertiary Australian hospital around improving the quality of medication administration. And this is it's an open access paper, so you might like to do some further reading. But this really highlights the JBI evidence implementation approach, and it also highlights the use of PACES within it for the various phases. So have a look at this paper if you're interested. And I think it's an interesting read, and it was done across multiple sites with multiple participants inputting data, and it's a really good example of some of the current implementation work that's been done. So, Robin and Michelle, thank you so much for joining us today and sharing of your experience and your expertise and the way that you've grown and developed using the JBI evidence implementation approach, and supporting the work of obviously using JBI PACES as well. So we're so glad that you're able to join us. Any final thoughts or comments?
No, thank you so much for asking us. We enjoy sharing and enjoy sharing and working with JBI. It's just a great resource for anyone in the clinical setting that needs access to best practice. So thank you for inviting us.
Yes, thank you so much, Alexa.
Right, thank you. So look, thank you everyone for joining us today, and we really we've enjoyed preparing and presenting this webinar. So please, you will receive a survey, a webinar survey at the conclusion of this webinar. And so please do take the time to fill that out. And there is a question there around whether you do want some more follow-up or information on JBI PACES, and then you'd be contacted by a representative from Wolters Kluwer Health. So please feel free to reach out. If you want any further information from JBI, there's our email there, or any other feedback as well. But as Robin and Michelle have said, we would love for anyone, if you have any questions, please do reach out. And we do really love talking around evidence implementation and JBI around our resources. So thank you for spending your time with us today, and hope you have a pleasant day or evening wherever you are. So thanks everybody.